You spoke about the potential of brain-computer implant in treating depression and addiction. How does that work?
Yeah, there are already brain-computer interfaces that are being
And addiction?
used. Yeah, I believe so. So there are deep brain stimulators right now, which are types of brain-computer interfaces that are being used to stimulate deeper parts of the brain for things like depression, essential tremor, Parkinson's, obsessive-compulsive disorder. In some cases, they can be effective, but I guess one of the limitations of the systems right now is that our readout of the systems is relatively limited. We are looking for clinical readout. In the case of Parkinson's or essential tremor, we're looking for a tremor reduction. In the case of depression, we're looking for self-reported outcomes. Something that a device like the one I showed you can do for those kinds of paradigms is directly decode neural states, so that instead of shooting in the dark and relying on self-evaluation and checklists and conversations with a psychiatrist or a neurologist, we can use brain data directly to understand when therapies are working. And that doesn't even have to be device-based therapies. We can also imagine using brain-computer interfaces to read out the efficacy of more traditional interventions like pharmacology or cognitive behavioral therapy. I think that the key thing that brain-computer interfaces will bring to mental health is a way to quantify whether something's working or not. Looking at biomarkers for things like mood and attention. We want to build hardware that is enabling for an expansive list of applications. Essentially, the brain is a data organ. Everything that we see, everything that we experience is data. Everything that we do originates as data in our motor cortex that's sent out to the muscles in our body. Cognition is neural data. Mood is essentially neural states, which you can say are neural data. And so a brain-computer interface can read and write neural data, which means that it can treat just about any neurological condition or most physical conditions that relate to a breakdown of the brain and the body. And so we want to just keep building better and better hardware so that we can do more and more for the brain using these devices.
What's your roadmap? When we can expect from your company first huge-scale implementations?
The first group of people that we want to help are people who can't speak any longer and have limited hand function. So in the US, that market is roughly 150,000 people, but with reimbursement of $150,000 per device, it's still a $20 billion plus market. That's where we want to start to get the company to a place where we're cash flow break even. But then the goal is that we'll continue to make every 3 years or so a new device that has twice as much data and has additional capabilities to be able to open up new markets. And so you can imagine, as we're describing, using these devices in mental health applications, using these devices to help control robotic arms, hands, eventually exoskeletons, and then also using these devices on the sensory side to restore lost senses.
Could your implants make us more happy?
I think we have to be careful of that. There are a lot of pharmaceuticals, there are a lot of drugs that make people more happy for a short period of time, but erode our humanity and our autonomy over a longer period of time. So I think that's something we have to be very careful of. The capabilities that we're building are going to be very powerful. They're going to be able to allow a person who is depressed to choose not to be depressed again. But I don't think that we want to try to engineer away sadness in society, because I think that the whole spectrum of human emotion and human feeling is part of what makes us human. So what I was saying is I originally got into this field because I'm still motivated primarily by restoring function, but I also think now that Paradromics is leading in the field, we have a unique position to direct the course of the technology in a way that will be, let's say, affirming of what it means to be human and increasing our agency and autonomy rather than decreasing it.